Ever wondered what kidney stones are and why they form? These little troublemakers are hard deposits made of minerals and salts that form inside your kidneys. When these components clump together, they can form stones varying in size from a grain of sand to a golf ball. Ouch! Kidney stones can have a significant impact on health, causing extreme discomfort and potentially leading to more serious kidney problems if left untreated. They're more common than you might think. In fact, 1 in 10 people will have a kidney stone at some point in their life. That's quite a lot, isn't it? While the concept of stones forming inside your body may sound alarming, it's important to remember that kidney stones are treatable and often preventable. With the right knowledge and habits, you can take steps to reduce your risk. Now that we've introduced kidney stones, let's delve into what causes them. So, what causes these pesky kidney stones? You may be surprised to know that kidney stones aren't just a random occurrence. They are actually the result of a combination of factors. One of the main culprits? Your diet. Consuming large amounts of sodium, for example, can lead to an excess of calcium in your kidneys, which can form stones. Similarly, a diet high in animal protein can raise the acidity of your urine, providing the perfect environment for kidney stones to form. But it's not just about what you eat. How much you drink matters too. Dehydration can concentrate the substances in your urine that lead to stones, so remember to keep well hydrated, especially in hot weather. Finally, don't forget about genetics. Like many health conditions, if your family has a history of kidney stones, you may be more likely to develop them too. With the causes clear, you might be wondering, how would I know if I have kidney stones? Let's find out. What are the indicators that you might have kidney stones? This question often echoes in the minds of those experiencing unusual discomfort. Let's shed some light on the telltale signs. One of the most common symptoms is severe pain, which can strike below the ribs, at the lower back, and even radiate to the groin area. This pain might fluctuate in intensity, sometimes sharp, and at other times, just a dull ache. Another sign to watch out for is hematuria, or blood in the urine. This can give the urine a pink, red, or brown hue. It might be alarming, but it's a clear signal that something might be amiss. Lastly, an increased urge to urinate, even when you're not taking in a lot of fluids, can be another symptom. However, these symptoms could also indicate other health issues, so remember, only a healthcare professional can provide a definitive diagnosis. Symptoms give us a clue, but how do doctors confirm it? Let's explore. How do medical professionals diagnose kidney stones? I hear you ask. Well, the answer is multifaceted. To uncover the presence of these pesky pebbles, doctors often use a combination of different diagnostic methods. The first port of call is usually an ultrasound. This non-invasive procedure uses sound waves to create images of the kidneys, allowing the doctor to spot any stones lurking within. But sometimes, an ultrasound isn't enough. That's where blood tests come into play. By checking the levels of certain substances in your blood, like calcium or uric acid, doctors can gain insights into why you might be forming kidney stones. And let's not forget about urine tests. These can reveal whether you're excreting too many stone-forming minerals or not enough stone-preventing substances. So you see, the diagnosis of kidney stones is a thorough process, requiring a blend of different tests. But remember, diagnosis is just the start. What about treatment? Let's discuss this next. Now, let's talk about how to treat kidney stones. The treatment for kidney stones depends on their size, type, and location, as well as the patient's overall health and symptoms. For small kidney stones causing minimal symptoms, a wait-and-see approach coupled with pain management might be the best course of action. Pain control is a crucial aspect of treating kidney stones. Over-the-counter pain relievers such as ibuprofen can help, but in severe cases, stronger prescription medications may be necessary. Additionally, drinking plenty of fluids can assist in flushing the urinary system and help the stone pass. For larger stones or those causing significant discomfort or complications, more active treatments may be needed. One such technique is extracorporeal shockwave lithotripsy, or ESWL. This procedure uses sound waves to break up the stones into smaller pieces, making them easier to pass. Another treatment option is ureteroscopy, where a thin tube is inserted through the urinary tract to the location of the stone. A small basket or laser is then used to remove or break up the stone, respectively. For very large stones, a procedure called percutaneous nephrolithotomy might be necessary. In this procedure, a small incision is made in the back, and a tube is inserted directly into the kidney to remove the stone. Patients with certain types of stones might also benefit from medication to help dissolve the stones or prevent new ones from forming. For example, those with uric acid stones might be prescribed medication to lower the levels of uric acid in their urine. Remember, it's crucial to work with a healthcare professional to determine the best treatment plan. All treatments have potential risks and benefits, and what works best will depend on the individual patient's circumstances. Medical treatments are effective, but are there ways to manage kidney stones at home? Stay tuned. What can you do at home to manage or even prevent kidney stones? Kidney stones, those pesky little mineral deposits that can cause so much discomfort, can indeed be managed and even prevented with a bit of care and some lifestyle changes right at home. So let's delve into it. One of the simplest and most effective ways is to drink plenty of water. Staying well hydrated helps dilute the substances that can lead to stones. It's like giving your kidneys a good flush every day. Aim for at least 8 glasses of water daily, more if you're active or live in a hot climate. Next, let's talk about diet. Certain foods can increase your risk of kidney stones, particularly those high in oxalates like spinach, rhubarb, nuts, and wheat bran. Reducing your intake of these foods can help, but don't eliminate calcium from your diet, thinking it might cause calcium stones. It's quite the opposite. Dietary calcium actually helps reduce the risk. Just avoid calcium supplements, as they can increase the risk. Reducing your sodium intake is another dietary change to consider. High sodium levels can increase calcium in your urine, leading to stones. So, avoid processed foods and season your meals with herbs and spices instead of salt. Regular exercise is another key. It helps reduce blood pressure, which in turn reduces your risk of kidney stones. Whether it's a brisk walk, a bike ride, or a yoga session, get moving for at least 30 minutes a day. And lastly, maintain a healthy weight. Obesity is a risk factor for kidney stones. A balanced diet and regular exercise can help you achieve and maintain a healthy weight. Remember, while these home remedies can help prevent kidney stones, they're not a substitute for medical advice. If you're experiencing symptoms of kidney stones, see your healthcare provider. Now, let's wrap up what we've learned about kidney stones. Let's quickly summarize what we've learned about kidney stones. These hard deposits are formed in the kidneys when there's an excess of certain substances in your urine. They can be quite painful and can cause symptoms like severe back or side pain and blood in urine. To diagnose kidney stones, doctors often use tests like urine, blood tests, or imaging tests. Once confirmed, treatment depends on the stone's size and type. Small stones often pass naturally, while larger ones might require medication or even surgical intervention. And let's not forget the role of home remedies. Drinking plenty of water, consuming foods rich in citric acid, like lemons and oranges, and limiting intake of oxalate-rich foods are some simple steps that can help prevent these stones. Remember, awareness and early detection can make a big difference when it comes to kidney stones. Stay healthy.